Okay, welcome to another episode of Mom Talk. I need a full rundown, catch up of everything with all your appointments and medicines and everything because we haven't talked about it in so long. And I haven't seen you in person for even to talk about your last appointment.
So, also, I just want to say we've had a lot of people recently message.
Yes, about
Some have been on my private or my personal page, and some have been on the Mom Talk page. But a lot of people about the PAH.
Mm-hmm. I feel like you need to say what it is again.
I don't know. I was about to say
Okay,
that.
because I'm like everybody needs a refresher.
So yeah, I have something called pulmonary arterial hypertension. This rare progressive lung thing that I developed at 29, and I'm on meds for it, and I'm doing pretty well. But I have a lot of appointments, and I do research visits because why not?
Yeah, like
If I'm
they're
gonna have this
researching
anyway.
you to help
To help
find-
me.
to help yourself.
Yeah, I mean, ultimately to help people with this. And if I am lucky enough to have it, I am going to use it for something.
Yes.
So yeah, I had a research visit last week.
Mm-hmm.
It's like one of my longer research. I think it's the longest research visit I do.
Like time-wise, how long you're there?
Yeah, I was there from 8:45 to about 1:30.
Oh yeah,
So like a full day.
And driving to Nashville.
Yeah. So Jarrett went with me, like always.
Yeah, I think that was one of the questions. Does Jared always go with you?
And
Yeah.
he does. He does go with me every time. So nice. And I know I could ask other people to go with me too, but I don't want to ever feel like a problem.
Like a burden?
Yeah.
Well, he has no problem going.
And he literally signed up for this.
Yeah,
Nobody else did.
the marriage license is signed.
I mean, sickness and health, right?
Mm-hmm.
He probably didn't think 29 is when that would start. Anyway. But yeah, we went to Nashville, got there. The research center is its own little building. So walk over there, meet my coordinator. Most of the research studies I do are with pulmonary people.
Mm-hmm.
This one is with the cardiac.
Okay.
This one looks at your heart, sees why certain people with this condition develop right-sided heart failure and some don't.
Okay.
I don't have right-sided heart failure. I don't have congestive heart failure currently. None of that.
What's the percentage of people that do?
I don't know the exact percentage. I know
That higher rather than lower?
a lot of people don't get diagnosed until they have some type of heart failure.
I'm sure we've touched on this before, but I feel like now that we know a little bit more about it, I feel like you did get diagnosed quicker than
I got
other
diagnosed
people.
incredibly fast,
Yeah.
like so fast compared to so many people.
Yeah. I mean, I still feel like your first couple visits were kind of the runaround. Not to diminish that,
My first 2 ER visits were
because they want to write you off as anxiety.
a pinched nerve and anxiety, yeah.
Yeah, so I'm not saying that didn't happen, but overall, I feel like you got diagnosed faster once.
People literally go years. And they are all but bedridden when they get diagnosed.
I just can't imagine, and also what that does to them mentally.
Yeah.
That they know how they're feeling. And the doctors are like, oh, you have anxiety.
Head. Like, have you tried walking? And they're like, I can't walk across this room.
Makes it worse.
So, yeah, I've tried, and I would love to walk to the bathroom without.
Yeah.
So, yeah, they've tried. They've probably also tried every anxiety medication.
Right.
If this is anxiety, surely I
Because
can
shoot,
fix it.
yeah, why not?
But you can't because it's your lung. And I get it's rare, and it's not every doctor's, first thing. And,
Right.
have you ever heard the saying, if you hear hooves, think horses, not zebras? Because
No.
why would it be a zebra?
I've never heard that.
It's
but
like,
I get what you mean.
it's a chronic illness
Like, that's not
metaphor.
what an ER person on call is probably thinking about.
Yeah. But that's like, I guess some doctors have been told this.
I
Like, look for the most likely things first.
mean, I do know you've got to go through a whole checklist of
And I get that.
A, B, and C before you can get to D.
But if you've done A, B, C, D, E, F, G, why can't it be H?
Right.
And they're just like, no, it would never be that. That's so rare. I'm like, it is.
Mm-hmm.
It sure
It is, and I have it. Yeah.
But rare doesn't mean it doesn't exist.
Right.
And rare does not mean anxiety.
Does age play into this for people? Like we had our gallbladder out when we were super young, and people are like, oh, you can't be having your gallbladder out. You're too young. But does PAH have an age?
So I am the right age for my type of PAH.
Okay.
The idiopathic kind likes people my age, primarily female.
I find that interesting. It is primarily female.
Mm-hmm. There are a lot of studies going on right now that look into a hormonal component since it is primarily female. It's a female-dominated condition.
Okay.
So, yeah, it's interesting.
Mm-hmm.
And especially since, like, I think it's late 20s to mid-30s are when you get diagnosed.
Mm.
More often than not with the idiopathic type. There are other types caused by other things. And those, you could be in your 50s, 60s, whatever.
Okay.
But for my type, yeah.
You're spot on.
I'm the demographic.
You're a girl in your 30s.
I am a girl in my 30s.
Yeah.
Yeah. So I do think that is interesting. But research visit, I had to be fasting.
Okay.
And you know I'm a night eater. I don't know if we've said that. Surely we have.
Victoria gets up in the night.
I'm so hungry at night. I always have been. Like since I was, I don't know, super young, I feel like.
Yeah, that's your thing.
Just hungry.
Mm-hmm.
So I had to be fasting, and that's hard.
Mm-hmm.
I also have to take a lot of medicines in the morning.
Yeah. Do they make you nauseous if on an empty stomach?
No, not really nauseous. I just can like feel my stomach, and I don't like that.
Yeah.
I'm like, oh, I need more than water.
Yeah.
So they do my labs first thing because
you have to be fasting.
Yeah. And this is a fun game to play. How many vials of blood did they take this time?
Oh. Wait, what's your highest number ever?
My highest
one
number
sitting?
Ever, I believe, was 19.
Okay, and that's when you got diagnosed. Okay, I'm going to go with 6 this time.
11.
Oh, wow.
It was a lot.
So, I mean,
I've done this study once before. It's a 4-year study, so I've already done it twice. I'm halfway done.
Okay.
And
I did not know it was 4-year.
Yeah.
Okay.
So last year, when I did it this year, I was like, oh, yeah.
That's
I
right.
remember from last year, I was like, wow, this is a lot of blood you're taking.
Yeah. Do you know everything they're testing?
No.
Okay.
And that's fine. Some of the stuff posts to my portal. Some of it I will never see.
Mm-hmm.
And I mean, that's fine.
Right.
I don't need to know because if there was anything wrong or like critical, they would tell my doctor so that it could benefit me in my treatment plan. I still don't even really need to know.
Right.
She can adjust things if something pops off weird. But yeah, it was a lot of blood.
That's a lot.
And I am fine with blood draws. They don't make me sweaty. They don't make me nervous. I don't mind. I don't like needles, but I'm fine.
I mean, praise, because some people have issues.
I just didn't have that luxury in this life.
No.
I can't have an issue. I've never been afforded that luxury.
I mean, this is not the same at all, but I would cry and be so scared and pass out. And then I was like, what am I going to do when I get pregnant?
Oh, yeah.
Then I have to do it.
Yeah.
But you just do it.
You just have to.
So, yeah, you just have to. And there's 19 at a time.
I just had to from a young age because the SVT when I was younger, it started when I was 4.
Yeah.
So literally my whole life, I have not had the choice for this to be a problem.
Yeah.
Which is good since they want to draw 11 tubes for me.
And you don't get lightheaded.
No. On the 19, when I'd been in the hospital and not eating or sleeping for a few days, when I was getting diagnosed, on 17, I was like, okay, I'm fine. I'm going to be okay. I've never, and it's literally a mental pep talk of you do this all the time. You're going to be fine. You've done this your whole life. Yes, this is a lot.
Yeah, definitely a lot.
So I didn't pass out or anything, but my dad and brother were in the room.
Oh, I already know.
And they had
They're
to get
not
up
trying to do that.
They had to walk out.
Okay, but your dad's a firefighter.
Yeah, he doesn't do blood like that.
He doesn't do blood like that? Okay.
Also, I'm his child.
I was going to say, that's totally different.
Not that he doesn't, he cares about other people.
Well, yeah, but when you're a daughter and you already probably don't look well.
I did not look well, and I just got handed this diagnosis, and that's at the point where we had all Googled it.
Don't take me back.
So depending on what you read when you Google this condition, if you haven't already from where I said it earlier in this episode, it's going to tell you I have anywhere between 2 years to 10 years, depending on which article you read.
You know where it's these monumental things happen in your lifetime, and it's do you remember where you were?
Yeah.
Yeah, I remember.
Gotcha.
It got me good.
Were you at work?
No, I was home
Oh.
by myself.
That happened on a Monday?
I was outside. No.
How?
This was like, you told me in an afternoon.
That's when I found out it was in an afternoon.
Yeah, you told me in an afternoon. So I don't know what day of the week it was.
I'm pretty sure it was a Tuesday.
Yeah, then I would have been home.
It was definitely a Tuesday.
I was like, okay, the earth has stopped spinning. I mean, it's like that moment.
Yeah, you just Google it and the end.
It's like, well, I'll just wait to hear back from her another time.
Yeah, there was not much to say to that.
Yeah.
So yeah, it'll tell you 2 to 10 years, depending on how you respond to treatment. And that's scary. Is what it is.
I don't believe that.
2 to 10 years.
Right.
Longer. It is true for a lot of people. I'm very fortunate that I respond really well to the treatments that they've done. Also, I think we did a whole episode about my heart cath last September, but finding out I was a vasoreactor meant we could change up my meds, and it's best case scenario.
Right. You're on the lesser
the best case of a pretty bad thing. And yeah, I'm very functional, and it's been 2 years, and I'm still just as functional. Well, I'm way better with meds, but yeah. So untreated, absolutely, I don't think I'd be here at this point if I did not have meds. Like how I felt back then, I cannot imagine 2 years later that I would be here.
Because of how bad it was.
It was that bad.
Yeah.
So I do think that's accurate if you are not treated.
Okay.
And for all these people who have like a delayed diagnosis and can't get treated, yeah.
Yeah.
Probably 2 to 10. 10 is generous.
Yes, untreated, like you said. Yeah, that would be generous, I feel like.
Especially for my type. Like, it's wild. But, yeah, I've had time to let that sink in.
We're at the 2-year mark.
Yeah. We just hit 2 years in August. And I feel pretty good. I'm still really functional.
So you've been on the med change for a year now.
Almost a year, yeah.
Almost a year. Are you having any sort of checkup for that?
Yes. I still have to go, well, let's say it'll be 3 times total this year for regular appointments to check.
Okay. And what does that look like? She asks you how you feeling?
Yeah. How are you feeling? 6-minute walk.
Okay.
6-minute walk. If I pretty much like park my car at Vandy, I'm 6-minute walking with somebody. But yeah, she'll 6-minute walk me, talk to me. The biggest thing is that I have had swelling, which I knew could be from the condition itself. It can be from any of the meds that I'm currently on. She did add Lasix, which is a fluid pill. Probably, I want to say January maybe, because I had to titrate up on the new med. And once I hit my max dose, I was like, ooh, my ankles don't
swollen.
exist.
Yeah.
My leg just blends into my foot. And that really helped the swelling for a long time. I do have more swelling now, and I am going to have to tell her about that when I go in December. And I might have to tell her about that before I go in December.
Because it's gotten worse again.
It's bad. It's really bad.
And it doesn't matter if you're standing or sitting.
It does not matter if I stand, sit, lay down. It doesn't matter.
Was it like that when you went to your research the other day? Like, is that something they would notice and ask about? Or?
They did ask about it because part of the research day is you have to have a physical by one of their physicians. So that was one of the questions they asked. They do check, but like that was a morning thing. And in the morning's not.
It's better.
Fine.
Yeah.
It's as the day goes on, they get bigger and bigger and bigger.
Yeah.
So I'm like, not right now, but they have been getting big again.
Did they comment on that?
I mean, it's just par for the course with all of this. So they're not shocked by it.
Okay.
And I'm not waking up like that. Now, it is very uncomfortable. Because when they said you might have some swelling, I was like, oh, okay. I did not think that meant pain.
Does it hurt? Or does it like feel tight? Or
both?
Yeah.
So like it hurts inside. It hurts to like walk at all. Like put any pressure really hurts. My skin feels tight in some spots too because
it has nowhere to go.
I mean, it expands pretty rapidly when it starts doing it. And like if I'm wearing jeans, like
Yeah.
where it constricts, or leggings, shoes, anything that touches it hurts. But yeah, hopefully we just up the fluid pill and that fixes it.
Like, are you on a low dose of the fluid pill?
I am.
Okay.
That's the only thing I haven't maxed out.
Okay.
I'm on max doses of everything else.
Okay. Okay. What else did you do with the research study the other day?
After I got my 11 things of blood drawn, they were like, step on the scale real quick, and then you can get a snack. I was like, sold.
Yes.
So, and I think I've mentioned it before, they had this really nice like snack area. Like
yes,
a lounge.
you told me it was fancy.
Yeah, it was
very
like,
nice.
Gosh, somebody's grandma stocks this for sure. So I got some snacks, and they were like, do you want to do your walk? We have a little time until the MRI. So I did my 6-minute walk. I only did 10 feet less than what I did last year at this appointment.
Okay, how do you feel about that?
I feel good about that.
Okay.
10 feet's not a big deal to me.
Okay, good.
Like, also, my ankle.
Oh, right.
I'm getting old.
Right.
My ankle's jacked up. So if I did 10 feet less with a busted up ankle, and I have dropped off of my walks.
Right. You were like training.
I was training. And you know what? It's a little bit like disheartening that I worked so hard for this 6-minute walk to only do 10 feet less when I don't train myself.
I feel like it was so mental for you in the beginning to prove to yourself you could still do
X, Y, Z.
Yeah.
Yeah.
And that's why I was so nervous if you got less on your walk that you'd be really hard on yourself.
And I have been.
Yes.
But this time, with it only being 10 feet less, I'm like, okay.
Yeah.
Like, that does not bother me.
Okay, good.
So I did my walk, and then I got to eat a little bit more of my snack, use the bathroom, and then we had to go back down to the MRI, which I think I kind of said this last time. You go like down into the depths of this research center.
Yeah, you're down in the dark dungeon basement.
And there's like laundry and janitorial services keep supplies down there. And you walk, and then you turn this corner and you walk into like a whole doctor's office looking situation again. I'm like, where am I?
That's weird that you walk through that, I think.
I mean, I think it's the only way to get there.
Yeah, that's weird.
I mean, it's interesting for sure. I'm in the MRI.
How long is that?
Forever. It's 45 minutes on my heart and then 20 minutes on my leg.
Okay. You know, I've never had one.
Are you claustrophobic?
You know, people ask that when you say MRI, and I don't know if I am.
Well, how do you feel about a tanning bed?
I mean, I have done it, but I also know I can open it. Like,
how do you feel about that being shut for 45 minutes and you can't open it?
I might have to really prep myself for that.
Yeah. And then, okay, I've had MRIs for other things before. A cardiac MRI, or at least this research one I do for this, they tie a respiration. Is that what I'm trying to say? For respiration?
It sounds like a word, but I don't know what you're about to say.
Respiration band around my waist.
Okay.
It doesn't hurt. It's just a little band.
Okay.
And it's not super tight. Then they put this giant, I don't know what it's made of, because in the MRI machine with you, shield over this. And they say it helps their camera. And I'm like, helps your camera by blocking my heart? Cool. So this thing over you like this, except it's thick. So in a normal MRI, I feel like you have about this much room, like when you're laying flat, that you can see out.
Like you can at least see down over your,
over your body.
Yeah.
You can see out. They put this giant shield on me on top of the respiration band. I swear to you, it was like 1.5 inches where I could see out. I was almost completely like, couldn't see out.
No.
And
was it heavy on you?
I mean, it was like a little.
I'm picturing like a breastplate in a war.
Like heavy. I don't know. It felt like a weighted blanket almost.
Okay.
But it also didn't touch me all the way. Like it kind of like hovered around me. And, you know, I did this last year and I was like, oh, it wasn't bad.
You blocked it.
Blocked it. I do like this MRI machine though. I've been in one before that doesn't have like, it's around your head too. This one has like, it's a donut. So you just kind of.
Okay.
My head is still completely in it, but the back of it opens up and there's like a fan or something blowing on you.
Okay. Oh, do you get hot or cold?
I get hot because I'm nervous.
Okay.
Like, beforehand, they asked me if I wanted a blanket or a sheet or anything. I was like, nope.
You
They're like, it
remembered
gets
that.
cold in here. And I'm like, I know. And good thing.
Yeah.
But the coldness blowing on me, I did actually get cold. And I would rather be cold.
Okay.
Especially in that situation. If I'm hot, I'm going to, like, throw up or something.
I mean, true. And then you're stuck in there.
So I survived my 45 minutes.
Mm-hmm.
I need to listen to this episode next year before I go.
Yeah, for refresh.
Yeah. 45 minutes, they let you come out. They have to set up the contraption your leg goes in.
Mhm.
So, bathroom break.
Okay.
Got to walk around and, like, come back to myself a little bit.
Mm-hmm.
And then it's just this weird little box, and you plop your calf down into it, and they lock your leg in.
Okay. And then
And
she
just
sits there for how long?
20 minutes.
Okay.
But my head is out.
So you're fine.
So I'm just like, I can take a nap. I can relax. Like, I've had adrenaline pumping. I am in fight or flight. Let me just calm down for a minute.
Yeah.
So 20 minutes on my leg, pop up, walk back through the basement to my nice little comfy room.
Yes.
And everybody comes in ready to do my CPET.
Was that the bike?
Cardiopulmonary exercise test.
And there's like a mask attached to your face.
Yeah, there is. They got a new bike.
Oh, fancy.
I know. I did better on my bike this year.
Oh, how do you feel about that?
Well, I think I pushed myself a lot harder this year.
Did it take you longer to recover?
It did.
I mean, do they want you to push yourself, or is this supposed to be a baseline?
No. So they do a baseline. They're like,
okay,
just pedal.
Okay.
Like, don't, because they want you to pedal in a certain range. You have to keep it between however many rotations per minute.
Okay.
Between 55 and 60. They want you to be as close as 60 without going over that you can.
Okay.
So pretty much a pedal per second.
Okay.
So they have you just like do it at first, and they get their baseline reading of your pulse, your O2. The mask also helps measure how much carbon dioxide is coming out.
And what is this mask attached to? Just a machine?
Yeah. It like
this
goes into the computer.
I was going to say, this is not like a surgical mask. This is like you're breathing into something.
Yeah.
With
and
a
Jarrett,
tube.
He's been there twice, and he's like, is there something in your mouth, like, while you're doing this? I'm like, no, but it does kind of look like that.
It?
Like, if you look at the pictures, it almost looks like it's right over my mouth, and it is, but I don't have anything in my mouth. But they tell you not to talk while you're doing it. And I don't know if it's every 2 minutes or every minute, but they take your blood pressure and check your pulse. They don't check your O2 that frequently, I don't think. I don't remember it. They do everything in different increments of time. Like, if they're checking your blood pressure, they don't check your O2 because it can skew it, even though it's on a different arm. I don't know. And there's this scale that they want you to rate your level of, like, breathlessness, chest pain, like your discomfort level. And it goes 0, 0.5, 1, 1.5, 2, 3, 4, 5, 6, 7.
Okay.
I think it goes up to 10.
Wait, how do you tell them if you can't talk?
You have to point. They hold up the chart and you point to where you are.
Okay.
So at first I was like 0.5. I'm like, oh, like I'm chilling. And then they're also increasing the resistance and making it harder for you to keep that 60 per minute. And I went for a good while, and it wasn't that bad. But when it gets bad for me, it gets bad so quick. I was like a 0.5, and I was like 1, 1, 1. I stayed at 1 for so long. Like, I could tell I was doing something, but it felt doable. And then it was a 3. I was like, okay, like, I've been doing this a minute. I can tell the resistance is there. And, like, 2 minutes later, I went from a 3 to a 9. I was like, I'm going to. Like, I had to call it.
Yeah.
Because you call it.
Oh, you do?
You call it.
Do you call it like lengthwise? This is how long I can go?
Yeah, pretty much. Like, you can stop at any point, and that is where it's done.
Okay.
They're not going to push you beyond that.
Well, then I already know you pushed it. If there's no end time.
There's no end time. And I don't know how long that is. I'm sure it's in my portal. I can probably see that. But, yeah.
So what did it feel like when you were done? Can't breathe at all?
Can't breathe. Please get this mask off of me. And they do that very quickly, because, like, by the time you call it, you can't breathe, or you're having chest pains or all the above. Like, they know. They know why you're there.
Yeah.
So, yeah, got that off. And they had me sit on the bike. They want you to cool down. Like, don't just come to a halt. That's not great either. Like, slow back down. They don't care how many you get per minute anymore. It's just a. And for that, well, yeah, that was a 12 lead EKG the whole time I did that. They were very aware of how fast my heart was. It got up, I want to say it topped out at like 189.
Oh, wow.
It was beat. And they wanted to get back down to what it was when you started. So mine was 83.
Oh, so you had a
So I was
drop
over 100 up.
Yeah. How long did it take you to drop?
25.
And
they get back to there.
And they just kind of watch you.
Yeah, you're just like laying on a hospital bed.
Okay.
Waiting.
So there's no like alarm on their end. They're just letting you cool down.
Yeah.
Okay.
And I mean, if I did get dizzy or pass out, these are all like, there was a doctor present in the room, PA, 3 nurses. Like, it's a full.
You're covered.
It's a full room. Because you're taking somebody who has this condition and can't breathe and has heart problems potentially. I'm sure people do push it hard and pass out or have chest pain. I think that helps their study probably a little more if you can push yourself to that point. Like, don't be dangerous, but it might be a little dangerous.
I know you are.
But no, so my bike test, once that came back to normal, they were like, okay. And I have to like check in and check out like at the hospital. So we got there and checked in. You go to the desk, kind of like you would if you were going to the hospital. Get you a little sticker and band for your day. And then when you're leaving, you have to give it back.
Sign out.
Yeah.
Were you finished after the bike test?
Yep.
Okay.
Obviously, the MRI is the longest part of it.
Yeah.
A 6-minute walk takes 6.
Do you and Jared go like at lunch or anything? Or by the time you're done, it's time to get the kids?
So I did want to get back to get the kids. I did have a backup plan for that if I was done in time. Or, I mean, if I had been able to ride the bike longer, who knows? So since that is dependent on me, I'm like, I need a plan for the kids because I'm not going to cut this bike ride short to make sure I'm back.
Right.
If I can do it. Kids, you're going to be waiting after school. But yeah, it was good. And I get to do it all.
Yeah, okay, I did not know that. I didn't know how often it was or how long it was.
Yeah, so it's once a year for 4 years.
And then your next checkup is in December.
So I have not had a heart cath this year. My last one was September of 24. So I think I'm going to get away without getting one this year. I know.
I really thought, okay, that you got diagnosed in August, and then I didn't feel like she did another heart cath on you. I don't know why. Like, when the year mark happened, that I thought it, like, went past August.
Oh.
Like, I thought you had one earlier this year.
No. I had the one at diagnosis in August of 23, and then I had a follow-up with my specialist in September of 24, because she wanted to kind of see where I was a year after being. So I don't know what it looks like as far as when she'll want to know how these new meds have been working. A lot of this is based off functionality.
Okay, so how you feel it day to day?
Last time when I had the swelling, she checked my pro-BNP, which is a hormone that's released with the stress of your heart. There's a normal range, like to work, that's considered stress, and you want your heart to work, so you want some stress. But under 100 is good.
Okay.
And I have been under 100 the whole time.
Okay.
Again, I don't have any heart failure, so that's good.
Good.
But she likes to check that with swelling because congestive heart failure can also cause the swelling.
So next on your list is possibly telling her.
I'm probably going to have to tell her
that you've got more swelling.
Yeah. So I'm going to have to tell her, and she'll probably up the fluid pill and check my pro-BNP. I see her in December that day. Kind of a long day too, actually. I don't have like a pulmonary function test or anything scheduled currently, but I do have an echo. So an echo is the best non-invasive way to get a guesstimate about what my pressures are.
Okay.
Now, I've had echoes be pretty close and spot on to what my heart cath said. Like, heart cath is the goal to actually know. At diagnosis, my echo and my cath were wildly different. my echo that I got before the heart cath showed my pressure in the 80s. When I did the cath, it was actually only 36.
Right.
So still had it, but not in the 80s.
Yeah.
That was getting me sent home on IV meds for sure.
Wow. Yeah, that's a huge difference.
Huge. Then the ones I've had since then, like I had an echo, I don't know, sometime last year before my heart cath, and it showed my number, I want to say at like, I don't know, we'll call it 34.
Okay.
And then when they did my heart cath, it was 32. So pretty spot on.
Yeah, pretty close.
And I've had so since I've been diagnosed, because that's the only, like I said, non-invasive way to check it, other than my symptoms. But I do them for research plus my clinic visit. So I've had a bunch.
Have they been pretty much the same in the 30s?
They have shown nothing has been higher than my diagnosis number with the cath. So nothing has been over 36 on an echo.
Okay.
I have had as low as 28.
Is that bad? Or
That's
that's better?
That's good.
As low as you go? Or is there a range?
20 and under.
Okay.
So like 20 is what will get you diagnosed.
Okay.
But if I could get into my 20s, that's a lot of progress, you know? So I am curious what the echo will say in December. If it's worse, I'll be shocked.
Okay. Because you feel good.
I do feel good.
Okay.
And
I wouldn't know if you didn't feel good because you don't be telling people.
No. I will say, though, that like feeling good is not what it was before all of this. Feeling good is way different.
You have a new form of what is the best you can feel.
I have a new like baseline. Like chest pain still happens a couple times a month, but not all day, every day. Shortness of breath happens again. That one's probably a little more regular just because I'm out here doing Bending over is literally the worst thing I think I can do.
It like constricts?
I don't know what it does, actually. All I know is anytime I have to bend over or like, you know, picking up kids' toys and bending that much, like that's the worst.
Yeah.
I make my kids clean up anyway, but they have got to, or I'm like, Mommy's gonna,
I'll be on the floor here.
I'll just lie down.
Yeah.
So, yeah, bending sucks. Yeah. I feel, yeah.
We're at 32.
Oh, good. Okay.
You wrap up?
But yeah, overall, I feel pretty good. I
Okay.
have my new normal.
I mean, I'm glad this is a positive catch-up report for you.
Yeah. And I feel like somebody did message me on my personal page. It's been a couple months now, and it doesn't bother me. Like, I get it. This diagnosis is hard and stuff. But they had listened to the episodes and were like, I don't think it's good that you steer people into like this like warm, cozy, like everything is all good vibe with this condition.
I wouldn't
That's
say...
the only person that has said anything like that.
I mean, obviously they're probably dealing with it
whatever,
their own way, but it's not that you haven't been through the hard, and it's not that you haven't said it's hard.
Yeah.
Like, this is the best thing that you can do mentally for yourself.
Right. And I'm not saying it's easy or that I'm out here feeling like I did before all of this.
Right. Yeah, I don't think you've ever claimed that.
No. And I never would because it's definitely different.
Yeah.
But I just think I know there are people like me, because that's overwhelmingly what gets said, that it's a weird spot to be in because you're not as bad as all the people who post in the support groups. So you almost feel like you have no right to complain because it could be worse. But like, it's still a lot better for a lot of people.
Right.
Like, yes, it could be worse, but it could be better. And just because I feel better than I did doesn't mean I feel good.
Right. You're feeling your new.
My new.
Yeah.
So for me, this is great.
I mean,
and also like I'm not dead. And truly I would be had I not gotten diagnosed when I did. I really, truly think that.
Yeah. I think you were with the right person at the right time for that diagnosis.
I mean, looking back on it and hearing the more stories I hear about how people get diagnosed, it is insane how I got diagnosed so fast.
Yeah.
Nobody I've encountered has gotten diagnosed as quickly. Nobody.
Yeah.
And I've talked to a lot of people now. Mm-hmm.
The people come to you.
Well, and I signed up to do the support line.
Right.
For
Which I think
people
is
with
great.
this condition.
Yeah.
And then like a peer mentor program.
Mm-hmm.
I signed up before I was like, what am I going to even say to somebody if they even want to talk to me? And now I've got like 4 people.
Yeah.
So,
I mean, I think you're really good at it and compassionate.
I mean, they like me.
Of course they do. Of course they do.
I'm a delight, y'all.
A delight. Okay, we're all caught up. I feel like it was a good catch up for that. I'm happy about that and appointments. So thank y'all for listening. Don't forget to follow us on our Apple, our Spotify, our YouTube, and our Instagram. Thanks.
Bye.
Bye.